everyone. Welcome to the Glow Podcast. Today I'm here with a very exciting guest. I have Dr. Tiffany here with me. And for those of you kind of just joining us for the first time on the podcast, we are Tailored Marketing and we help aesthetic clinics grow their businesses and scale them. So if you're interested or want more information, drop a comment below. Dr. Tiffany, I'm so excited to have you here today. And so can you kind of go ahead and give a little bit of an introduction to the audience to tell them who you are?
Absolutely. And thanks for having me. It's a real pleasure to be here. One of the things I do as an internal medicine doctor that specializes in longevity is to really help people heal from the inside out. And that's how you and I, of course, got connected, because there are some aesthetic appearances that are a reflection of how is your internal health. And it relates to a lot of different ways we could approach health, but there is that intrinsic connection. So I'm in St. Louis, Missouri. I own Vitality Medical and Wellness Consulting, and we help women primarily in their postpartum and perimenopausal years, so somewhere between 35 and 55, optimize their health so that they're not just living in the moment, they're living the long game. We want these women to be able to hike across Europe when they're 90 if they want to do that, rather than sitting in a rocking chair. And that doesn't start when you're 89. You have to start that decades earlier. And so that's the work we're doing and the investment we're helping women make in themselves.
Yeah, no, I love that. I think that that's great. I think it's becoming more of a focus within medicine, but also kind of not primarily the focus in Western medicine. Sometimes we're not really into the preventative care that you talked about. It's more of, fighting these different things as they come up. So how did you kind of get started into this work, and what kind of opened you up to this more holistic medicine rather than just the typical way that we've seen people do it in the past?
It's kind of a surreptitious story, so I'll hit you off the highlights. But essentially, it's my own story. And it was realizing that as a patient navigating the healthcare system, first, there's an enormous gap in care for women after they've had their baby and before they really have to get settled in with primary care. And that could be 5, 10, 15 years, depending on when that postpartum journey starts. But particularly in the realm of preventing heart disease, stroke, dementia, diabetes, and kidney disease, there's a lot of data emerging that just the data's there. We have the science, but it hasn't intricated itself into all clinical experiences for all women equally. There are places who are highlighting it, and a lot of those academic research centers are doing their best where they're at, but it's not equal care for all women. And I live in a state, Missouri, where there's a decent amount of rural capacity that's not being served.
Yeah.
And having experienced gestational diabetes in all of my pregnancies, but then in my last pregnancy, I also had preeclampsia. And as I studied the literature and looked at why did this happen, I wasn't interested in the solution, which I was taught in medical school. The solution was just deliver the pregnancy and be done. But my position and what I propose in my TED Talk was that you really have to understand that pregnancy wasn't ever the problem.
Yeah.
The pregnancy was a gift that unmasked a problem which was already there. And not being pregnant anymore, delivering the child, doesn't make the underlying root cause actually go away. We have to solve the fundamental problem, which is cellular illness. And you might hear this called different things. Sometimes people call it metabolic health, but it's a whole area that continues to evolve. The research continues to emerge that this is really a problem, and it is the fundamental root problem. Interestingly, it's also the same problem that gives you wrinkles faster and skin tags, and you don't get the aesthetic things that we all want, right? And it contributes to aging and premature aging at that. So my own story was, this is a really crappy experience as a patient to go into a Western medicine clinic and be told, well, you're not pregnant anymore, so there's no more problem. And yet there is. And as I investigated this for myself, I started to notice my patients in a different light of conversations and hearing what they were saying. I was like, oh my gosh, this is the systemic problem that we need to be addressing for these long-term conditions. And if we want to prevent these problems, we need to be a lot different in what our actions are that we're taking. And so over the last 5 to 10 years, as I've had this journey and this evolution in my own thinking, it's created natural conversations and natural ways to think about medicine, health, wellness, and disease differently.
Yeah, I feel like especially because you have such a personal relationship to this cellular health, metabolic health, whatever you really want to call it, it gives you a new perspective for your patient, because they're like, okay, she really gets it. You've been there.
It's hard to change.
Yeah,
If it
definitely
was easy,
is.
we would all do it immediately, right?
Yeah.
It's actually no different than smoking. If it was easy to stop smoking, everybody would.
Yeah.
So I don't find a lot of value in judging people for where they're at in their story. And that's really a critical mindset change, because while we're all taught in the healing professions, accept people where they are, help them get better, the reality is that there's a certain amount of judgment that happens. Right?
For
There's
sure.
a certain amount of, why can't they just do what we say? Well, if you've ever actually tried to do what your doctor says, it's stinking hard. Or you'd already be doing it, right?
For sure.
And there's a whole element too of misinformation and miseducation that has happened and continues to be perpetuated through generations. And some of that is intentional and some of it hasn't been intentional, but it is the reality where we're at. And so I find a lot of value having been a patient, having struggled to figure out I'm doing all the right things. Why is nothing changing? Really isn't the right chapter of the right book. We need to completely flip these scripts, get a new book, get a new chapter, and personalize it to each woman, to each person.
Yes. No, definitely a very individualized approach for each person because everyone is so different. What do you see with some of your patients that changes that you are implementing that are actually working? Because as you said, changes are very, very hard, and it's like psychological, it's physical, it's emotional, it's all of these different things. So how are you helping your patients with actually implementing real changes in their lives?
Yes. So there's several mechanisms for this. It's definitely multi-pronged approaches. And while there may be similarities and patterns that are offered to different people, they're not all right at the same time. You would never tell someone who's sitting in a wheelchair, okay, you need to go get up and do your exercise every day, right? You're going to say first we go to physical therapy if it's a recoverable illness. Then we're going to do this next step, and it's very piecemealed, right? The other part of it is training in nutrition. What do we know about nutrition science today? And then how does that actually work in your life? Can you afford the foods we're talking about? Do you have access to them even if you can't afford them? And then if you can't access them, you can't afford them, what modifications can you make? And I try to come at this with each patient from a very curious perspective of an assumption that they know their life better than I do, right?
Yeah.
They are the expert in them. And when they tell me, hey, I've tried all these things before, I say, that's cool. We don't have to try anything that's failed, but help me understand what you've actually tried, because many times what people have tried is based on old science and old evidence. And if I find that that's where they are, I ask them, can I show you a different way? Are you open to hearing different things? And again, you're the expert in you. So if this doesn't ring true to you, I'm not saying you have to do it. I just want to make sure you have a full informed body of evidence to make decisions from. And I find that that open conversational back and forth works much better than me saying, you need to exercise for 30 minutes a day and you need to do this, that, and the other, because they're going to just start tuning me out and looking at the clock and saying, when can I leave? And that doesn't add any value to them. It doesn't add any positive impact to the people around them who will eat similarly to them. And so my perspective is, let's play the long game, not just for the person sitting in front of me, but for everyone around them in their community. And then when it comes to personalization, a lot of it depends on not just their education, but what are their resources. If they're working 2 jobs, I cannot realistically expect them to be spending an hour doing some type of physical activity a day. But maybe they can do 3 minutes every hour of air squats, for example. And that has to be very intentional. You have to figure out how do you build those habits in. But there's a lot of creative ways that we can make even people who are not able to do a traditional approach, or what we assume is the correct, right approach to care, we can personalize it to them and for them. And that's where our value is, right? It's where can they take charge. And a lot of it's habit building. And part of our habits come from our mindset. If we think, for example, that, well, I had cake for lunch, now I've just blown it for the day, I might as well keep blowing it, right?
Yeah.
No, we have to say stop and say, okay, you had the cake from lunch, but now we're starting over. And of course, if you just start over after every meal, you haven't really changed anything. But the point is to challenge those intrinsic patterns and habits of thinking that are giving us results we don't want.
Yeah. No, I feel like mindset's a really, really important piece of any change, really, that we're building in our lives, And so I love that you bring that into it with the holistic perspective, but also bringing in a sustainable approach for each person, because what is sustainable for me may not be sustainable for someone else, and vice versa. So it's very, very important to incorporate the whole lifestyle into it. And going back a little bit to what you were talking about earlier with the metabolic health and cellular health, whatever you want to call it, basically, so how are you kind of gauging that for patients where they're at with that? Obviously, everyone's at a different place and there's different things that we can do to kind of see where people are at. So how do you gauge that for each person?
So we do quarterly lab tests, and I find that that's really important because, to the point you just made, the changes that are right for me may not be right for you. But also, the changes that worked for you 5 years ago may not work for you today, particularly if you're in your perimenopausal years, which is a 10 to 15 year span before you even go into menopause. So if what worked for you before isn't working for you today, that leads to frustration unless you understand why and what's happening in your body. But primary metabolic markers that we're looking at are things like your HSCRP, which is a marker of inflammation in your body that we can measure and we can monitor to know what's happening inside your blood vessels. We check fasting insulin levels. We want to understand what is your pancreas responding to. If you have a high insulin all the time, that doesn't necessarily mean that you have insulin resistance, but it's pretty suspicious for it.
Yeah.
And then if I find evidence of insulin resistance in forms of your fasting glucose being elevated or your A1C being above about 5.1%, that tells me we have metabolic dysfunction. If your liver, your ALT enzyme is elevated, again, that's metabolic dysfunction. There's even some ideas that early kidney disease may be a marker of that. And so as the evidence continues to emerge, we go with it. In terms of the cholesterol story, which a lot of women will tell me my cholesterol's been fine until now all of a sudden it's high after I'm starting these perimenopausal changes. Some of the things that we look for is, well, what kind of cholesterol do you have? Do you have really large or very small particle sizes? And are they mostly in your HDL, your good cholesterol, or in your LDL, your bad cholesterol? We want to know, do you have a genetic mutation for lipoprotein(a)? There was a pretty massive study that was in the New England Journal of Medicine back in the fall of 24 showing that women who have this mutation, as well as an elevated HSCRP and an LDL, that bad cholesterol elevation, those three, that trifecta, is really convincing that that woman's going to have cardiovascular disease, which we could include not just the heart in that definition, but all your blood vessels. So the blood vessels in your brain that lead to stroke, or in your kidneys that lead to kidney failure and eventually the need for dialysis. Like, these are the types of markers we can predict 30 years in advance you're going to have a problem.
Yeah.
So if you know that, in my mind, it's like, why the heck wouldn't you want to do something about it now if it could change your outcome?
Yeah.
And so we're looking for those biomarkers to understand. We don't traditionally measure hormones all the time, and there's controversy on this. I'm a certified menopause practitioner, and I tend to follow what the Menopause Society recommendations are, and that's, you look at the woman in totality, and you look at the symptoms they're having, and measuring hormones is tricky because they do fluctuate so much, and different labs have different reports. So I don't find that enormously helpful. I do it in select people, but even then with a big disclaimer that this isn't the be-all end-all, right? It's a single little snapshot of data in a specific instance of time. I find that the biomarkers that are much more helpful to metabolic and cellular health are those that we talked about just momentarily ago.
Yeah, no, that makes sense for sure. And right now, obviously, I know you're in St. Louis, which is a pretty big city. Like you said, you have a lot of rural communities around you. So how are people primarily finding out about your clinic right now? Like, is it pretty, like people are becoming more aware of this, or what do you see kind of the trends in the market with more of this holistic perspective towards healthcare?
I think as women become more aware of their ability to be in charge of their own healthcare, it becomes a natural extension that they start to take action upon that awareness.
Yeah.
So then they start looking for what's out there. And so the Menopause Society is a really big organization that follows the data, follows the science, lists in every community who out there is either certified like myself or just a member of our group and aware that there's even a difference that these women need to be treated with. And so that's a really great resource. And I do notice a significant number of women find me in that manner. Of course, if you love your doctor, you tend to tell people that you love your doctor, right? And so I find that women communicate just fine without me doing anything. Of course, we have an online presence, and part of my desire is to be able to reach people that will never see me otherwise, right? To put value into their hands so that they can go, even if they're in California or Papua New Guinea or wherever, to their person. And so we post on social media almost every day, whether it's Instagram or Facebook, I think YouTube, TikTok, LinkedIn, we're on all of them. And the value I'm hoping to offer to those individuals is the truth. Where's the science at? What do we know that's different? What do we know that's right? Where do we need to change our thinking or challenge the concepts we've had all our life. One of those that I pick on the most is a balanced diet, because a balanced diet only works if you have a balanced cellular health baseline.
Yeah.
If you have metabolic abnormalities, you have no business eating a balanced diet. We need to personalize it for you. So there's different things that we do in that capacity. And so sometimes people will find us, if they're local, they'll notice us on Instagram or something and say, hey, I want to join. Different ways that people find out about us. The TED Talk I did I guess now it's been a year, spring of 2024. People find me sometimes through that. But there's lots of different ways. And I just want people to realize the truth and to make the decisions that are best for them. And right now, having navigated this both in a professional sense and a personal sense through the healthcare system, it's a murky mess. Right? And so to be able to say as a guide, a friend, an advocate, these are the things you need to do, that's my calling. It's making a difference in people's lives.
For sure. And like you said too, social media is really powerful because anyone in the world could be listening to what you're saying, or what you're posting. And it's very powerful in that way when you're listening to someone and you feel like they're advocating for you, because what they're saying is speaking directly to what you need to hear. So I definitely agree with you that, you can get your message so much further now. There's just so much access to education. And what do you think is like the most important thing that you want to educate people on, that you're like, people need to know this?
Okay. Yep. So my passion, I'm not a cardiologist, but my passion is that women should not be dying of as much heart and vascular disease as they are. If you look up the data year over year, you're going to find that women die of heart disease, which we're going to call heart attack, heart failure, vascular disease, stroke. Okay. They die of cardiovascular disease in totality in the United States. There's more women dying of that than all cancers combined for women. How much do you hear about screening for cervical cancer at your GYN? Or how much do you hear about screening for breast cancer and maybe even colon cancer or lung cancer? You hear about it all the time.
You do.
But you don't hear that we have to lump all of those together, and still all the women who have that, more women die of heart disease. On top of that, all those women with heart disease, with cancers, they're more likely to die of heart disease too, even though they have cancers. So if the fundamental problem that's killing women is cardiovascular disease, then in my mind it makes sense to put my efforts toward preventing that. And one of the obvious things that people think about is, well, I don't want to have high cholesterol, or maybe I need to stop smoking. Maybe it's that I'm getting diabetes. Very obvious conversation starters. But what's most important to me is that you understand as a woman, what are the signs that aren't traditional? What is unique to a woman that you are going to have to deal with that could impact your heart disease risk? So things like polycystic ovarian syndrome, things like preeclampsia, gestational diabetes, preterm birth. If your baby was born before 37 weeks, you're at an increased risk of heart disease. I don't think most women know that. At least the women in my clinic, almost 100% of them come in and they're flabbergasted when I tell them, did you know this is a risk for diabetes or heart disease? And so if I'm having almost 100% of my patients tell me that, that suggests to me that this is a big problem in education in women globally. On top of that, you've got the perimenopause symptoms, and women are aware that they may want to take hormones or have a conversation about that, and it's not right for everyone, but it's also not poison. And the fundamental problem with the menopause transition that women don't realize is a risk factor for heart disease is if you have bothersome hot flashes and night sweats, that is a risk factor for heart disease. And for me not to offer you hormones if you're an appropriate candidate is, in my view, malpractice, because I know that if I don't treat that, I'm letting you be at higher risk for heart disease, and that's unacceptable to me. So the fundamental message I want women to hear is you may have novel risks for heart disease that you don't realize simply because of your gender. If you've had PCOS, preeclampsia, gestational diabetes, preterm birth, or symptomatic menopause defined by hot flashes and night sweats, you need to be working with someone who understands those are actual independent risks and we can do something about it.
Yeah. And I've heard this before. I don't know if this is true, but I've heard that a lot of studies, especially that we have about heart disease, are based off of men and not women. And so I don't know if that is changing with obviously our landscape and research and everything, but is that changing? Is that true? Do you?
Yes. So number one, it's true. Somewhere around 1993, roughly, you can look it up and quote me and correct me, but 1993 roughly, that we started having women's independent included in studies and not just saying women are little men. Just like we wouldn't say children are little adults, we don't need to be saying women are little men. And so, yes, that that was true, that there historically hasn't been a preponderance of data. The second thing that's true is because of the political landscape in which we are in, it has eliminated a lot of the funding or the study capacity that's promoted by the government, which does drive significance, if not most of the research. There's always outliers. You could always find someone who's like, my study's fine, I'm still studying women. And so, right, it exists, but there's a marked decline because of what's happening currently in the administration's allocation of funds for female studies.
Wow. Yeah. And that, I mean, even like 1993, maybe they didn't know, you could potentially argue that. But now at this point in time, we definitely know that our bodies are very, very different, and operate completely independently, really, of one another. And you can't necessarily generalize studies for men to women because our bodies are so different.
Correct. And what's interesting is there's also differences on age. So a premenopausal woman versus a postmenopausal woman is going to have something different. You can understand things that are going to be different because of pregnancy. You can understand too that even things of ethnicity, your skin color may be the same as someone on another continent, but that driver of that skin color may give you a different outcome. And so it's more than saying just ethnicities in the US, it's where are the global ethnicities tangled up in all this, and there's not a lot that we know as well as we would like to in that regard, where we have an early understanding. But that kind of research takes years, decades sometimes to have flowing in. My position is I don't have time to wait for that research. I need to be treating the person who's sitting in my exam room now, today, and we have to make the best educated treatment plans with the information we have, knowing full well it may change, right?
Yeah.
In 1993, roughly, they were making plans based on men's health. New studies come out and they're like, oh my goodness, I need to change this now according to the patient in front of me. So that will continue. It will always be something that's an evolution that we go through over time. But what's important is to constantly come back to the science and what does the person in front of you need. It's very appropriate to understand averages, but you also have to personalize. And population health is a big deal because it tells us on average we need this number for this type of person. It doesn't help me though when I'm looking at the person in front of me, say, what's the best for you? And I'll give you an example of this. Several years ago, there's a large study that came out and showed that we really should be keeping adults' blood pressure 120/80 in general, less than that. But if I try to take a 90-year-old adult and they've got a high blood pressure all their life, and I'm trying to get them down that low, they may pass out. And that's not healthy if they fall and hit their head or break their pelvis, So you have to use wisdom in all of this. And while we may have population health data and averages, we then have to turn around and say, does this apply to my patient? Is the person in front of me the same person that was studied?
For sure. No, that definitely makes sense. And right now too, with obviously the landscape of health is always changing. We've kind of talked about a little bit of that. Where do you see kind of the trends in the industry headed with where you are with metabolic health, with perimenopause, postmenopause, all of these different things? Where is the industry headed?
So I think the industry is in a vulnerable position because it is regulated by government. Much of what's paid for is determined by insurance, third parties, right?
Yeah.
And I truly don't believe they have malicious intent, but I think that whatever their intent is perceived as malicious by most people.
Yeah.
When the USPSTF came out, when Obamacare and all that happened, one of the big things they said is we're going to pay for prevention, right? And they defined what prevention was, and you can go look this up. They clearly say what they consider prevention. But to the average person sitting in my clinic, when I tell them we need to do something, a test, a procedure, whatever, and then they find out it's not covered by insurance, they don't understand why is that not preventative. And it's based on very standardized and very thoughtful discussions based on the evidence that's there. But remember, we don't have evidence always until 10 or 20 years later for the question we're trying to address today. And on average, it takes somewhere between 14 and 17 years for science studies to be implemented in clinical practice, even at the best institutions. So I don't want to wait that long, but that means that people have to accept that they may pay out of pocket more, which doesn't always work for every person. And even the people who have access may not want to use their funds in that way because they're paying for insurance.
Yeah.
So you see people triaging their care, rationing their care, really not taking some proactive steps they could be because they feel like it's a financial penalty to them to go down that road. The other thing I see is because people so badly want to take control of their health, and I rightly applaud them doing that, the problem is they turn to lesser studied and lesser structured options. Now, I don't think all supplements are poison. I also don't think all supplements are appropriate. And that goes back to that personalization for each individual that's sitting in front of me. I see a lot of people taking more and more supplements because they consider it natural. And that may be true. But a lot of what we should be doing is not spending the money on supplements, but we should be spending it on the correct food for ourselves.
Yeah.
And using the data our body gives us, either in symptoms, how do we feel, what's our energy level, do our joints hurt, what's our skin look like, how's our hair, or are we basing it just on this idea that I think I'm doing something good?
Yeah.
So we do support certain supplements, and we use certain supplements in certain disease processes if a person chooses that road. But we're going to tell them there's supplements, there's prescription medicines, there's food as medicine. You need to know all your options to make an informed decision. So I think there's a rebellion against the healthcare entities as experts in everything, right? And you're not an expert in me, you don't know my story. And I think that I've seen that for the last 15 years, people telling me, I realize this is what doctors think, but I know my body, is what they'll tell me. Like, cool, tell me more about your body, right? But that's not how I was trained. That was an intentional decision I made to learn more about that person and partner with them, and deviated from the way I was trained. Because the way I was trained was evidence-based medicine is king. Yeah. And that's true to an extent. We have to understand and use wisdom and put them together. That's the art and the science of medicine, in my opinion, coming together to find the best solution for the patient in front of me. The other trend I see is because people are realizing insurance pays less and less, and they do want to be proactive. They're seeking out that care. They're looking for people who will help them. And the problem is you don't always know when you're dealing with someone who's legit or someone who's selling you snake oil. Most people think they do. And so I've seen people be deceived. I've seen people hurt. And I try very clearly to tell people, look, I'm all for it. If you want to do acupuncture or essential oils or all these things, just tell me. Tell me so I know what's going on, and then I will give you the best information I have, and you get to then make your decision. But a significant portion, the last I looked at this, I think it's close to 30% of adults don't even tell their doctor they're taking a supplement, for example.
Wow.
I can't guide you if I don't know it all, right? So you have to be transparent. If you can't be transparent with your doctor, you need to find a different one. And please understand, I am saying doctor loosely. I'm really talking about whoever your healthcare expert is. Some people don't want to see a physician. They see a nurse practitioner or a physician associate, whoever your expert is, a chiropractor. Make sure that they're licensed and they're certified. That's all I'm asking. And if they have those two things and you feel like it's a good connection and they're getting you results, then that might be your best option. I want you to make decisions based on data and results. And if you're not getting the results you want, you're not on the right path for your story.
For sure. No, that makes sense, definitely. And where are you headed and the clinic headed over like the next year or so? Like, what are the goals? What are the things that you're working on with your patients, working on outside of patients?
Our primary strategy is how do we prevent and reverse disease. So you got pre-diabetes, let's figure out how to reverse this. You have diabetes, same story, a little further down that road. If you already have high cholesterol, how can we lower it? What are the things that we can do for you? Listen, I use prescription medicines, and if someone needs a statin, I'm going to offer it to them, but I don't think a statin is the answer for everything. I think people need to know what their options are, and I think they need to know why I think a certain thing is a good or a bad thing. In terms of our clinic, what we're focused on is really a shift toward proactive medicine, longevity medicine, but disease reversal is the core of what we do. I was trained to treat diseases. I can treat whatever disease we need to treat with medication, but there's so much more. And it's important to me that you understand how you can use food as medicine, if a supplement's appropriate. What about exercise as medicine? What about sleep as medicine? What about dealing with the toxic relationships in your life or your toxic exposures within your environment or at work? What about trying to forgive yourself for some of the things you've carried and the grudges you're holding? Because all of that goes in. So, it is physical, mental, emotional. It's also spiritual. We are eternal, holistic beings. And if we don't put all these pieces together, we're not going to be well. And so we try to just offer people all of the options, and then how do we look at this from the long game? Because I, again, personally, unless Europe kicks us out, I intend to be able to walk across Europe when I'm 90.
Yeah.
So that means, I got to be strength training now. I need to be really making sure that my waistline is trimmed now. I need to be making sure that my grip strength is strong. So, for example, when someone comes in for their annual wellness visit, we're gathering data, not just on what your cholesterol and your blood pressure are, but how strong are you? We have a machine, we test your grip strength. Body composition analysis is really important. It's different for males and females. And so knowing where is your percentage of fat, muscle, and water content, where are we at with that, and how does that correlate to the data, the blood work in front of me? Where is your mental health assessment at? Where is your memory assessment at? So we're doing a comprehensive data collection, and then we prepare personalized reports for people with this information. And we're tracking and measuring any changes we recommend, because I don't want to just know what your health threats are today. I want to know, what are your health opportunities?
Yeah.
Where can we go in the future? Where can we change your trajectory? Where can we empower you? What are your mindset, attitudes, and habits that are holding you back? And that's why we also have health coaches who are board certified coaches, and they're certified in lifestyle medicine. There's only a handful in the country, and we have 3 of them. We want to be sure that you are able to take your next best step forward so that you can live better longer.
That's awesome. Yeah, I feel like y'all are doing amazing things. And I think it's really cool too that y'all are doing strength tests because especially when you get older, it's very important to have your strength. If you don't have your strength, you're going to lose your capability to do a lot of different things.
100%. I can't agree more. And, the number one thing that my people who are living with osteoporosis, and it's mostly women, but when I'm talking to them and they're wading through their treatment options, I tell them, the number one reason I see women lose their independence is they fall and break their hip.
Yeah.
So got to keep the bones strong. And that process doesn't happen overnight, but you can't feel it. You can't feel when your bones are getting weak. You can't feel when your blood pressure is getting high. You might see changes, right? You might have a curved spine and you can feel that you have no muscle in your forearms. You might see changes in your face, your skin. But boy, we can test and measure. So why can't we take a data-informed approach of you? It's your data. How can we not implement that in your care?
Yeah, no, that's amazing. Well, tell everybody how they can find you, how they can find your clinic online and all of those things. I'll also include it in the show notes for easy access, but if you want to tell everybody, that would be great too.
Yeah, so our website is vitalitymwc.org. MWC is for medical and wellness consulting, so vitalitymwc.org. Check us out on the website. Also, all the socials I was talking about, you can find me at Dr. Amy Tiffany for TikTok and Instagram and YouTube. LinkedIn, you find me under my maiden name, Amy Loden, and I'm there. And Facebook, you can find us with our clinic, Vitality MWC.
Awesome. Thank you so much for coming on the podcast and educating us. I really, really appreciate having you. So thank you so much for your time.
You're welcome. Thanks for having me. Happy to help.
Thank you.